You look at the chat. I'm just taking a look at the chat to see who's in the room, and it looks like we've got social workers, nurses, and healthcare providers from, oh gosh, all across the area. So welcome, everyone. I am so pleased to have you here. Well, I'm going to share my screen, and then we can go ahead and get started. So let me just take care of that here. Okay. All right. So again, welcome everyone. My name is Nicole Durain. I serve as a teaching associate professor at the University of North Dakota, and I work in the Department of Art and Design, and I teach art history. And I am giving this presentation, as you all know, as part of the Geriatric Workforce Enhancement Program's ECHO program. And the ECHO program provides sessions on geriatric care and age-friendly care. And today we're going to take a look at the visual arts and age-friendly dementia care. Now, the ECHO program is based on the GWEP's 4M's framework. That is what matters, medication, mentation, and mobility. And so when we take a look at dementia or consider dementia, it's often thought of as the mentation element of those 4M's. What we're going to take a look at today is the what matters element. So my work with the GWEP program focuses on what matters, and we're going to consider how the visual arts can be used in dementia care, age-friendly dementia care, especially with regard to improving quality of life for people with dementia and their carers. And again, if you have any questions, feel free to highlight those in the chat. Nicole will keep an eye out for that, and I'll continue progressing through the presentation, and I would love to answer any questions that you might have. Okay. So today we're going to do a few different things. We're going to describe the ways in which visual arts is used in age-friendly healthcare. And we'll do this by identifying two different ways that visual arts are incorporated into age-friendly care for people with dementia, and that is through passive and participatory activities. We'll also demonstrate the use of the visual arts in age-friendly dementia treatment. We'll take a look at a couple of cases, and we'll also take a look at one particular type of intervention through art therapy. Before I get started, I wanted to highlight a little bit about the literature on visual arts and age-friendly care. And one important point is that the literature is very fragmented. And what that means is that there's it's not a lot of literature on visual arts and age-friendly care, especially for people with dementia. And the literature that does exist really has a wide variety of methodologies and different foci. So I have a brief summary here. I'll start with a report provided by the World Health Organization in 2019. And the report was based on the question, what is the evidence of the role of the arts in health and well-being? Now, this report spurred a lot of interest in the visual arts in healthcare. And so there was a number of different studies and different literature that resulted from this particular report. And I'll use this report as the basis for some of the discussion in this presentation today. So for example, one of the results from this study from the World Health Organization, which focused primarily on the arts, and that means the visual arts, music, literature, theater. Today, I'm focusing particularly on the visual arts. So one of the impacts or one of the results of this study was that there was interest in looking at the impact of the visual arts on hospital patients' well-being. So how does the architectural design of a hospital impact patient well-being? How does, say, what a patient sees in their room, say, with regard to art that portrays nature or even a window that overlooks a natural scene? How does that impact patients' well-being and healing? And it was found that it has a design and also exposure to scenes of nature, for example, do indeed have a positive effect on patient healing. And we also see that there's literature on visual art and the design of long-term care facilities. So how does the design of the architecture or the artwork that's present in a long-term facility, how does that impact how people relate and then also benefit from that particular design? We'll take a look at two specific types of interventions today, and that is passive and participatory visual arts interventions. One of the things to note with passive and participatory interventions is that you don't need to be an artist to engage in these types of interventions. And so that's an important point because sometimes people might think, well, I'm not an artist or I need to have an artist lead these activities, but it's not necessarily the case. So we'll take a look at that in a little more detail today. Another thing we'll take a look at that's listed in the literature is multisensory interventions. That is interventions that utilize fine motor skills, interventions that focus on visual stimuli, or say engaging in visual perception. Now, the visual arts and age-friendly care have been shown to increase engagement or perhaps to benefit, again, a quality of life or impact personal growth and support meaningful interactions. And again, that ties to the what matters element of the 4Ms framework. And that is what we're focusing on today, really focusing on that, again, quality of life and how visual arts can be used to enhance quality of life. One way that it is evidenced is through increased social participation by engaging people with dementia and their carers in various activities that connect with their personal interest. And we'll also see how the art therapy can basically provide benefits in healthcare context. I'll end our conversation today by focusing on the specific type of intervention through art therapy. So we'll start with this question, right? What is art? And what is this thing that we're talking about with the visual arts? And there are a lot of ways to define art, and especially with regard to visual art. And the identification of visual art has changed a lot over time. And so the 2019 report by the World Health Organization, listed here, provides a definition that I'll use as a basis for our conversation today. So art is an object. And so something physical, something that you make, something that you look at. It can be something that has utility. So for example, craft, perhaps here are textiles. That might be something that has utilitarian value, or perhaps has value as an aesthetic work. So we see that with graphic design or architectural design, paintings, photography, sculptures, for example. We could have art that relates imaginative experiences or perhaps provokes an emotional response. I have a few works shown here that you might recognize. This is a work by Vincent van Gogh from the late 19th century. He's a post-impressionist artist. This is perhaps his most famous work, Starry Night. And this is a work that often is interpreted as an emotional interpretation of the artist's view of a night sky. And in this case, what the artist is trying to relate is his perception of death. And so we have a cypress tree that represents symbolically death, very common symbol in art. And then we have that in the foreground. In the middle ground, we have a cityscape with a church, the steeple piercing into the night sky, where we have this really exuberant and expressive night sky with all stars. And the idea what the artist is trying to relate here is that when a person dies, their soul becomes a star and populates the night sky. And so here we have this emotional response, an imaginative response to the art. Artwork could be something that's novel or original. So for example, here we have Gustav Klimt's work, who was an artist in the late 19th century, who was part of what's called the Vienna Secession movement in early 20th century. And so here we see he creates these naturalistic images of a figure that's called a kiss, people kissing, but kind of flattens the bodies with pattern and decoration. It's kind of a novel approach to depicting the individual at the time. Artwork could require a specialized skill. Here we have the Great Wave of Kanagwa. This is a Yuko-e-o print from the mid 19th century. And these types of prints, the woodblock prints, are incredibly difficult to make and require a lot of specialized skill. Sometimes art, it focuses on form, composition, or means of expression. And we see that here with Mondrian's work from the early 20th century. A theme in the early 20th century, really common, was a utopia. So, what would art in a utopian society look like? So, would you even need art in a utopian society? So, he breaks art down into something non representational, into blocks of color or lines and different geometric shapes, focusing on that form and composition. Sometimes the patron is important, like who paid for the work, and that determines what the artwork looked like. That's actually how much of artwork was determined. The subject of artwork and reception of artwork was determined for much of history. And so there's lots of different ways that we look at art. And for our purposes today, we're going to look at how art is an object and how art is made or how art is viewed as something that has utility or value, personal value, imaginative expression. And uh, and so how art relates to health and healthcare and personal well-being has a variety of different interpretations. And so art could be a multimodal intervention. What that means is that there's different ways you can integrate the visual arts into dementia care. So that could be through, again, a passive or participative intervention, or perhaps through art therapy, and that is art as therapy. And we'll take a look at that in a little more detail. Uh, Art and health relates in terms of aesthetic engagement, engaging the imagination, and helping people to express themselves, tying back to the concept again with the four M's, what matters to a person. We also see that art can activate sensory responses, again, through fine motor skills or perhaps through visual perception and engaging emotional responses. And when engaging with visual arts as treatment or intervention with people with dementia, it's important to have individuals there who are skilled at helping people with dementia to navigate those emotional responses, because some artwork could indeed basically instigate some emotional responses that might help, that means some management or help with management. It's a physical activity. Making something is a physical activity. Again, those fine motor skills, but it might require walking, getting up, moving, perhaps. We talked a little bit about engagement with nature, say having nature scenes in a healthcare setting. So this is a painting by Paul Gauguin, who, like Van Gogh that we just saw, was a post-impressionist artist. And this is a scene from his visit to Tahiti. We have these bright colors and natural landscape, and that engagement with nature could have, again, positive response on healing and well-being. Artwork can also engage cognitive capacities and encourage social interaction between people with dementia and also the carers for people with dementias, or carers and carers. And so one of the important things to note is that when engaging with visual arts in dementia care, it is really the literature suggests that it's more beneficial to have art interventions in a group setting as opposed to individual settings. And there may be interaction with art and healthcare settings, and then also really engaging individuals with healthcare themes. Now, the 2019 report by the World Health Organization highlights four areas where visual arts may have an impact in age-friendly care. So perhaps a psychological component through enhanced self-efficacy, helping people cope and regulate their emotions. The impact could be physiological by lowering a stress hormone response, perhaps increasing or enhancing immune function, and increasing cardiovascular activity through action and participatory activities. And walking around in passive activities where we see maybe looking at artwork or walking and looking at work. The benefits could be social to reduce loneliness and isolation, enhance social support, and improve social behaviors, or again, linked to behaviors through increased exercise. Adopt healthier behaviors and develop certain skills, again, focusing on, say, the fine motor development, like we see in this image here. So, when looking at the impacts of visual arts and age-friendly care, something that we might notice here is that it's really about, again, quality of life, that what matters component. So highlighting the visual arts as a way uh, to express what matters to an individual. Now, when we take a look at the outcomes of visual arts and age-friendly healthcare, there are two basic elements that you can consider. One is the prevention and promotion. And again, this is from the 2019 report from the World Health Organization, and the report identifies different elements for prevention and promotion. For example, looking at the social determinants of health, child development, caregiving, prevention of ill health, and health promoting behaviors. We're going to look today at the another type of outcome, and that is the management and treatment of disease. So it may be mental illness or acute conditions, neurodevelopmental and neurological disorders, dementias fall into that category, and then non-communicable diseases. Now, as I mentioned earlier, when we take a look at dementias, we're really not looking specifically at the say medical interventions or biomedical interventions, but more quality of life, focusing on what matters to people and how what matters can be expressed through visual arts production or perhaps discussion about visual arts. So when we take a look at the outcomes of visual arts and age-friendly dementia care, there's a few different elements that again relate to that improved quality of life. So maybe a sustained attention. And these benefits and outcomes typically last the duration of the intervention. So it may not kind of impact the progression of the disease, but can enhance, again, a quality of life in that moment through sustained attention, reducing social isolation, especially in group activities, focusing on behavioral amelioration. And with regard to the visual art intervention, oftentimes that intervention focuses on the patient well-being, looking at the patient as a whole, as opposed to a particular behavior. Could increase communication between a carer and a person with dementia or between carers and enhance security and belonging and a sense of safety and security and increase self-esteem with the production of art, a sense of identity. Now, the 2019 report by the World Health Organization, as I mentioned, integrates music, dance, literature. We're focusing on the visual arts in this presentation. And so the visual arts specifically can impact a sense of mindfulness, or perhaps encourage a sharing of memories, or perhaps reduce anxiety or agitation in patients with dementia. One important element is that the visual arts interventions and visual arts treatments for age-friendly care for patients with dementia are effective across all levels of dementia. So it's not necessarily that you're looking at one type of dementia or perhaps one level of dementia, but all levels of dementia. The literature shows can be people with all levels of dementia can be impacted through the integration of visual arts. So I mentioned we'll take a look at two different types of visual arts intervention. The first is a passive engagement. This is where we're viewing artwork. So we looked at this, for example, when we took a look at these works. So I explained these works and kind of gave you some of the context of the works and talked about some of the form and the meaning of that work. And that really is really learning about the work. This is a passive engagement. Usually involves a professional facilitator, someone who is knowledgeable about that artwork and can share the history, can share the context of the work, and oftentimes focuses on the aesthetic elements. So you might notice I was talking about the colors and the shapes and maybe some of the textures or the meanings of that work. Now, when engaging in passive engagement, that can happen anywhere. So it could happen in a long-term care facility, it could happen in a person's home. Sometimes people might take a trip to a gallery if they're able and engage with discussion looking at that work. And so when considering the passive engagement, there are a few things to keep in mind. One of them is glare. So if you're looking at a work of art, take a look at this work right here. It's got a piece of glass on it. That's how most visual artwork is presented, with a piece of glass on top of it. So if that work is positioned in such a way that it is presents a glare from the light that's reflecting off of it, or perhaps the glass isn't glare resistant, then that can people with dementia. So it's important to keep that in mind in terms of how you're presenting that artwork and making it comfortable and engaging for the people who are viewing it. And as we know, as people age, color vision deteriorates. So having work that has bright, bold colors, bold shapes is perhaps more suitable than works that are have lots of little details, perhaps. And so you might notice with the examples I showed here, of these bright, bold colors and broad shapes and various textures, which are pretty easily identifiable. And uh, and then, of course, ensuring that there are people present that can assist people with dementia and engaging with the emotional responses to the artwork. And that's an important element that is to make sure that people feel comfortable and helping people to engage with that work. Now, participative engagement is something different altogether. This is where people make the artwork as therapy, like an art therapy, or in therapy. And that might be, say, in a therapeutic session or perhaps as a leisure activity. Now, one thing to note with participative engagement is that there's really a lack of standardization in the interventions and in the research design. So it's not like there's this one way to do these interventions. Rather, there's a lot of different approaches that can be put into place, and really, it's up to how you would determine the individual responses and what would make the people with dementia and their carers feel more comfortable and basically ensure the comfort of the participants. One of the things to note is that to do this type of intervention, you don't need to be an artist. Really, the researcher or the provider is the facilitator. And with this type of intervention, again, it's really focused on the quality of life and improving quality of life. So the approach is really person centered. What that means, of course, is focusing on the individual as a whole and not just the disease or the manifestation of symptoms of the disease. The interventions are really best if they're delivered in groups. And so we see that here, for example, where we see people making art using watercolor paints to create work in a group setting. What this does is it improves cognition and could have a positive impact on the patient and the carer's mood, and really encourage communication, either through visual representation or verbal communication between the people with dementia and the carers, and vice versa. One thing to note is that, again, there's not just one way to do this. So there's lots of activities that can be used in these types of treatments and interventions. So painting with acrylic paints or perhaps watercolor paints that we see here are really a great intervention because it encourages the fine motor skills, encourages people to share their drawings and their paintings, encourages discussion, essentially. And drawing is another great way to engage participants. So When doing drawings, it's usually helpful to have a structured activity. And so, one great uh, uh, intervention might be a very simple thing to do is called a blind contour drawing, where it doesn't mean you close your eyes. It means basically you don't look at your drawing. Instead, you look at something, like if I'm going to draw this cup, for example, look at the cup and then take a piece of paper or some sort of drawing instrument and then draw what you see, but don't look at your drawing. Just look at the thing that you're drawing. And I can guarantee you it's not going to look like a cup, but it's really fun. And the worse the drawing is, the more fun it is. And so it's a quick 30-second, minute long activity, but it engages participation and conversation and again can be used to elevate mood. And coloring is another great intervention. Now, you can think about coloring in terms of color by number, or perhaps taking a coloring page, like a coloring book page, or some people with dementia prefer to just kind of draw what they imagine and use it as a form of expression. The point here is that when using the visual arts as an intervention, it's important to not just have one type of intervention, but rather to really engage people and have options that they can use. So maybe go from painting to drawing to what have you. So carers have a role in the uh, implementation of the visual arts in care for people with dementia. So, carers can really have a positive impact on the social and relationship building skills. So, it can help promote interest and engagement in the activity by engaging with the art making activity with the person with dementia, or perhaps, engaging with other carers. And that relates to essentially fostering that relationship between the carer and the person with dementia, that dyad. So, really, again, engaging people in the activity. This is especially, it was found helpful for people with severe dementia and engaging that dyad. In the same vein, it's important to allow the person with dementia to have autonomy in their art making. So, not necessarily to have the care guide that art making activity, but to encourage and to support the person with dementia and really stimulate that person's confidence in their art making ability and ability to express themselves or share their memories or to share their imagination. So the visual arts interventions can happen anywhere, essentially. So you can have the interventions in groups, in long-term care facilities, perhaps in people's homes. It could take place in galleries if, say, you wanted to have a more passive approach to the art making. And the participatory art making activities, again, can really happen anywhere and can be used across all levels of dementia. And it really focuses again on that building the quality of life, enhancing quality of life, and enhancing the imagination and building those relationships and reducing social isolation. Now, I mentioned we talk about art therapy as we wind up our presentation. So, art therapy is a specific form of a visual arts intervention. Now, the participatory activities and the passive activities that I mentioned, those can be done really as the provider, as the facilitator, the healthcare provider as the facilitator. With art therapy, this is a form of art as therapy and typically requires someone who is specialized and trained in using art as a therapeutic intervention. And so this is not really art as a leisure activity, but art again as a therapeutic intervention. And it's usually very interactive, where the art therapist is engaging with the individuals with dementia, like we see here, for example, in the art making process. The difference between the art as leisure activity and the art as therapy is that there's a specific focus on the treatment of outcomes. So that might be to reduce the symptoms of or the manifestations of the person with dementia might be experiencing. or perhaps to improve certain types of behavior. But again, uh, the use of visual arts in therapy or in interventions typically focuses on the whole person, not just on the specific treatment of the illness. And so that's an important point to note because it really it's not really a biomedical measure that is used. It's to observe the outcomes of art therapy, but more about the interaction and the um, well-being essentially of the patient, and really again focusing on that enrichment of uh, 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 life and that well-being with the person with dementia. So when we look at the measures of art therapy, what we see is that the measures focus on what is the level of social support. What type of level of aliveness or emancipatory potential does an individual with dementia experience? One measurement tool that is used often in art therapy interventions is the Greater Cincinnati Chapter Wellbeing Observation Tool. And this is a tool that uses short, continuous observation to measure things like engagement in the activity, levels of cognition, and interaction on various social domains with, again, the individual with dementia. And this, again, these interventions typically last the duration of the intervention. And the intervention is usually seen to be about 60 minutes or so or less. So not to be like really long, but rather to have a variety of activities in a shorter period of time that people can engage with. And again, because the art therapy interventions are focused on the whole patient and the experiences of the patient, oftentimes those measures comes from interviews or other qualitative measures like phenomenological studies or perhaps ethnographic studies. And again, focusing on the qualitative approach to research. And this means that there's a few controlled, systematic, evidence-based studies. And so this, again, is a little bit of a deviation from traditional medical studies that might be focused more on biomedical outcomes as opposed to more qualitative outcomes. So when thinking about the visual arts as an intervention, as a passive or participatory intervention, there's a few best practices to follow. So again, apply frequent sessions, and those sessions would be less than 60 minutes with a variety of activities, participatory activities within a single session. And again, the benefits may not basically impact the progression of the disease, but could help with the person's quality of life during that session. And the facilitators, that is the healthcare provider, or perhaps if you have someone who is a professional or specialized in that area, maybe an art therapist, support participants. And the goal is to make it enjoyable and comfortable for the person with dementia and their carers. And the carers have a specific role. So the carers can support the social relationships that emerge during those training sessions or during those sessions, those interventions can really engage the person with dementia in increasing interest in the event, in the activity, and also increasing engagement. And in terms of a passive approach, gallery visits, if possible, say taking people from a long-term care facility to a gallery or museum setting can really help improve a self-esteem, can showcase the social status of people with dementia. And literature shows that that can have a positive benefit to people with dementia. There are a number of museums that have initiated programs for people with dementia to visit museums and have, certain visual arts discussions. And again, following some of the best practices that we talked about today. So I wanted to highlight a couple of cases that where we see the interventions of, say, art therapy or passive and participatory visual arts interventions, both on behalf of the people with dementia and the impact on the carers. So I have two cases that I'll share. This case study, and I'll just flip over here to this website here. This case study is from the the AMA Journal of uh, let's see here, Journal of Ethics. And this is from an article published in 2014 on the use of art making in treating older patients with dementia. And so I wanted to highlight a couple of things that the uh, author of this article had suggested. And so the author of the article is a medical provider and mentioned how that the author and a neurologist visited with a patient who had early onset dementia. And so the onset was here in the 50s. And this patient was a practicing visual artist and had demonstrated some changes in the art making as a result of the onset of dementia. And so at a point in the artist's career, started making landscapes like this. And as her dementia progressed, the landscapes became flatter. And this is because the author suggests because of difficulties essentially of the visual functioning in the right hemisphere. And as such, this depth perception and perception of depth was really impacted. And so we see this in the artwork that the patient had produced. Another element that the patient had displayed was basically the way that the art making changed. And so here's a drawing that the artist made earlier before the onset of dementia. And after the onset of dementia, what the artist did instead of drawing would be to create collages, basically cutting up drawings and pasting them together to make unique forms. And so the author here indicates that there are three elements essentially that they found helpful in looking at how the visual arts could be integrated into helping the person with dementia have an improved quality of life. And these interventions, again, don't really slow the progress of the disease, but could, again, impact how a person experiences and those symptoms. And so, focusing on processing visual information and the actual visual functioning. And as a person who, lives in a visual society, essentially, and then again, focusing on the developing, enhancing of cognitive abilities, maybe encouraging a certain attention span over in an intervention during those maybe 60-minute or so interventions, and then developing some fine motor skills like we've seen in some of the images that we've taken a look at. And again, most importantly is that quality of life. Again, that what matters. So connecting with others, providing emotional development, brain plasticity, and resilience. And so again, what this case shows is that the art interventions helped to improve the patient's quality of life and provided a sense of hope. And so that is a key element of the visual arts interventions. Another case that I'll end with is it comes from the let me just come over here again. Comes from here, the Alzheimer's Society, which is, as you are likely aware, a great resource for various interventions with people with dementia. And so here, for example, we have a, a document about how the intervention helped essentially carers to relate to the person with dementia. In this case, we have a family who moved their mother in with them because the mother was isolated and lonely and exhibiting advanced or increasing uh, symptoms of dementia. And by having art interventions, you could really basically see the relationship building between the carer and uh, the person with dementia. And here, I just wanted to highlight other types of um, uh, of art making that can be used. So again, focusing on that what matters and quality of life. So using beading, perhaps with fine motor skills, or perhaps woodworking or carving, as we see here, or perhaps like we saw in the 2019 report by the World Health Organization, focusing on music, literature, other types of art interventions as well. And so, what I wanted to close up with here is just kind of highlighting some future directions of the research on the visual arts and age friendly dementia care, and just highlight that it's really uncertain because there are challenges, as we've mentioned, in measurement. The measurement and evaluation tools are not really focused on biomedical intervention, but more subjective meaning. And so we have more qualitative studies. And there's also needs to be and is a lot of methodological flexibility and even some disagreement on the theoretical concepts. So, as an area of research, the uh, uh, the directions that we see with the visual arts and age-friendly dementia care are really ripe with possibilities. And as we close up here, I wanted to leave you with a couple of questions and things to consider. So, does the impact of an intervention vary depending on the cognitive ability of the person with dementia? And studies have shown that that's not really the case. That this is effective across all levels of dementia, but perhaps future research might focus on how a specific type of intervention could help with specific types of dementia or levels of dementia. And then again, uh, assessment or questions about assessment, how to assess if interventions can be of use across dementia stages. These are areas that are future directions for research. Here's a list of the sources that I've used throughout the presentation, and I would welcome any questions or comments that you might have.
Feel free to either unmute yourself or just type a question in the chat. And just as a reminder, the evaluation link is in the chat for you to complete. And the post test is up right now.
Thanks so much, Sheila and Jan. That was really appreciate the feedback, and it was really a lot of fun researching this topic and sharing this with you. And yeah, any questions, please send my way. Yeah. Maddie, thank you so much for the comment. That's really wonderful. So, oh, you took two of my courses at UND. Oh my gosh, that's wonderful. Well, now you're a practitioner. So what are you doing these days, Maddie? Wonderful. Yeah, I see you work in long-term care. Yeah, thank you
Sorry,
so
I
much for
had
coming
to
today.
figure out how to unmute myself, but I'm in South Dakota and I'm a long-term care ombudsman. So I'm doing resident advocacy and things like that. So
Well, that is perfect. Thank you so much for sharing, Maddie, and congratulations. I'm so proud of you. And hopefully this information will be helpful for you as you are, again, the ombudsman and advocate. Oh, yes, Margaret, what a great question. Okay, so Margaret is asking, is there any evidence to support caregivers taking on art-related therapy in a home situation, or does it need to be led by a trained facilitator? That's a fantastic question. So this is something that, I was investigating myself in the research because I thought, well, what do you need to be an artist or a trained facilitator? and you don't need to be a trained facilitator. So that is really the case for participatory interventions, especially. Say art as more of a leisure activity, as a way to engage the person with dementia in activities that could, again, enhance the imagination or social development or interaction, et cetera. And so if you're working with an art therapist and using art as therapy, in that case, it would be beneficial to have a trained facilitator. But in terms of if you're thinking about doing some home intervention or maybe an intervention in a long-term care facility, then just just being there and kind of encouraging people and engaging people in that activity is helpful. Thank you so much, Margaret, for that question. Okay, Mabel, thank you for your comment. Mabel states that I, as an OT, had the pleasure of working with an art therapist as part of the activity therapy department and often displayed the artwork in a gallery on the walls of the inpatient psychiatric unit. Oh my gosh, I love that so much. Yes. So this is something I think that has a lot of power to and to really benefit the person with dementia, the carers, people who visit, that is to showcase the artwork. And that is a really important element to really build that sense of pride and sense of communication. So, and so here you work with an art therapist. And so that art therapist, again, was likely using that intervention as art as therapy and then showcasing that work. Fantastic. Thank you, Mabel, for sharing. Something that I do that I work with the GWEP program is I visit the Spirit Lake elders on the Elders Day Out and do art making events. And in that case, we do lots of different types of activities. We've done, say, drip paintings. So you take like a special kind of paint that is really fluid and kind of drip it onto a canvas or to a surface and engages mobility and social interaction. Say maybe uh, acrylic painting on canvas. And that was a really powerful moment because we invited the elders to share their stories of what they had painted. And it was one of the first times that the elders had kind of verbally expressed themselves and their stories. And so we really focus on the element of storytelling and being culturally sensitive and relevant. And we just did blind contour drawings, which was a lot of fun. Oh, yes, sorry, I missed Gunjan's comment here. So Gunjan was saying about the Elders Day Out, and do we have any thoughts on how those sessions help the older adults? That is fantastic, Gunjan. Thank you for bringing that up. So I just described some of the interventions that I've worked on with the Elders Day Out, and our next intervention, our next activity is watercolor painting, which should be a lot of fun. And those, the um, the visual arts interventions, I think, have a really big impact on the elders in a couple of different ways. One of them is helping the elders to tell their story and to communicate and build a sense of identity and a sense of pride, essentially, in their work. And so oftentimes the elders will draw images of their family members, or perhaps in one intervention that we did, one activity we did was card making, make cards to deceased relatives as a way to express their emotions and their identity with that work. And I did do one passive intervention where I gave a talk on Northern Plains Indian art. And one of the great results from that was, again, the focus of that particular intervention was storytelling and how uh, uh, American Indian artists have used the artwork for storytelling purposes and then invited people to tell their stories. And it was really wonderful just hearing people open up. And so that was the art can be such a powerful intervention. Yes, Wanda, love the card idea. It's actually really great. So we just had cards, you know, you can get them at Michael's, pre-made cards that are just blank and with envelopes, and then have markers and other art making tools like, for example, stamps. Those were a really big hit because they don't require a lot of dexterity. And so you can get a lot of colors, a lot of designs, and then having the markers present, people could color and they could write as well. And writing poems, it was a very meaningful activity, I thought. And people were using those cards to express themselves. And I brought examples that my children had made. Which was a really great starting point to show kind of what the card could look like. So that was one of the ways that we address an visual art intervention. I would love to hear if you had, you know, if you decide to use visual arts in your care. I would love to hear your stories. So please share them with the Web Echo staff, and they'll send them off to me, and I would love to hear about it.
This is Mabel, Nicole. So I just wanted to share that one of the other things that I did, working on the inpatient psychiatry unit, I used small canvases and tempera acrylic paints, but made it more of a sensory experience. So what I wanted them, the activity was make it a mindful activity and help them to experience the sounds of the ocean. So I had that initially on. Then I had the smell of something like citrusy, right? And
Yes.
so, uh, no, not citrusy. I'm sorry, like coconut scent, only because the idea was on the canvas, we just started with just a plain, like let's say red or yellowish color, and then we added to it seagulls, we added to it land, we added to it some water and a palm tree, so that that way each one would be able to take their canvas back to their rooms, and whenever they felt stressed and needed something to focus on, to even do a 5-minute meditation, they had their serene canvas of just like an ocean view with a palm tree and a sunset.
Oh my goodness, Mabel, that is amazing. Thank you so much for sharing because you highlighted so many different elements, right? The multisensory approach
Mhm,
and then engaging people in the moment, right? But
mhm,
then also using the product as a passive engagement. So in the future, right? Because they
mhm,
could look at that work that they created and remember that moment or feel that sense of calm. And that has,
mhm.
you know, research has shown that that actually has a pretty big impact on how people feel in an environment. So kudos to you, Mabel. That's amazing.
Thank you.
Any other questions or experiences for Nicole?
Well, I'm just appreciative of the opportunity to be able to share the visual arts with you and different ways that you could integrate them into your practice. And also just kind of think about the visual arts as a tool for improving quality of life and what matters to people. So thank you so much for the opportunity and for being here. I really appreciate it.
Thank you, Nicole. Have a great day, everybody.
Yes, thank you.